Hey everybody, and welcome back to another episode of Design to Move. My name is Ryan Maxwell. This is Hunter Schweitz. We are two movement specialists here at Fluid Health and Fitness. And today we're going to take you through another Design to Move video tutorial on another motion imbalance or movement imbalance that we see in the everyday population. This time we're going to talk about labral tears of the shoulder. If you have questions, you can reach out to us at admin@fluidhealthandfitness.com. Remember, this does not substitute medical advice, and we do have a table of contents over here in the corner that you can refer to if you want to skip to any of the segments throughout the video, or go to the video condensing and the tutorial at the bottom, which is going to take all the elements that we go over and condense it into a shortened version if you just want a basic tutorial. The main thing to take away from this orientation is that the shoulder and the way that it moves is all relative to how it sits on your rib cage. So oftentimes when there are issues within your shoulder joint, and today we're talking about labral tears, it's because the mechanics of the shoulder are not appropriate, and it leads to an additional wear and tear in the joint because it's not moving as it's supposed to. Now this can happen from an acute trauma, like falling, where your arm falls back. A lot of times people who engage in ballistic activities like skiing, surfing, skateboarding, there's lots of things where again you're going to take a fall. Now that is different. We're talking about chronic overuse of the shoulder joint that leads to, again, a breakdown. Now remember that the labrum is basically cartilage that wraps the ball of the humerus, or the head of the humerus, and it helps to keep it structurally supported inside what's called the glenoid. And the glenoid is a little recess of your scapula that literally makes up the shoulder joint. Now when we move our arm, we don't think about our scapula being able to move as well, but they are two independent structures. The arm will move within the joint, and the joint is made up of the scapula and the little recess of the scapula. So there is a rhythm to that motion. Unfortunately, if the scapula is moved forward and there's hypermobility in that joint, it will lead to a natural shortening or reduction of the space of the head of the humerus in that joint, creating compression and a potential for wear and tear or shearing on the labrum or the cartilage that cushions it. Now what we want to do today is show you how to release the muscles that are going to pull that shoulder anteriorly and inferiorly, creating the obstruction in the clean gliding path of motion for the humerus, and then show you how to activate the muscles that hold the rib cage down, allowing you to maintain the right positioning for the shoulder to rest on the rib cage in the first place. Oftentimes you'll find individuals or other tutorials out there on the internet where they're going to talk about just working the mechanics of the scapula, but they don't address the actual relative position of the rib cage, and so the symptoms will always manifest themselves. Here at Fluid, we want to look at it globally as an interconnected position and make sure that we're approaching this with the right set of resources and right application so we can make it go away for the long haul. So before we get into the actual release strategies, which we're going to use this lacrosse ball for, if you need one, you can always buy one from us on our website, so go ahead and check it out. But we're using this lacrosse ball to reduce two muscle groups today. These are overactive muscle groups that help to distort the shoulder position on the rib cage. The pec minor and the levator scapula. And with that, grab your lacrosse ball, let's get to it. The pec minor is a little muscle that lays underneath the major or pec major, and the pec major allows your arm to come inward and internally rotate the arm. Okay, so you use that muscle a lot when you're doing pushing movements. It's your primary mover of the arm, okay? So the muscle that we're talking about actually lays underneath of that muscle, and it's called the minor. It's an accessory respiratory muscle, meaning that it assists with breathing in. And again, going back to the relative positioning of the rib cage, we want to make sure that this muscle is not over-facilitated because it will lead to altered mechanics and breathing, and obviously distort the way that the shoulder is on the rib cage. Yeah. So when it's tight, it's going to pull the shoulder inward like this, which pulls into the back neck muscles, changing the positioning of your skull and head positioning, and then creating a forward ascension. And that again alters the mechanics of the muscles around the shoulder, neck, and the base of the skull. So this is something that we're going to want to get rid of, and it feeds into a muscle distortion pattern called upper cross. Obviously we have a lot of techniques out there for people working behind a desk, and this is going to really magnify the relationship or distortion in the shoulder. So we want to address that. So in order to get to it, you're going to use a little lacrosse ball. It's grippy, it's viscous, it's going to help to create a bracing on that pec. And what you would do is you would trace the little ridge of the humerus, you'll find a little indentation, and then go in. Now it's going to be under your collarbone, right underneath, and about an inch down. And if you palpate with your fingertips, medial to lateral or inside to out, you'll feel a little diagonal line. It's a triangular muscle. So you're gonna place the ball right at the apex of that rounded position, and then we're gonna use our body weight to leverage into the ball and then put pressure on that ball on that muscle between the ball and the rib cage. Now, once it's in position, you're going to stretch it under tension. This is called a pin and stretch technique. It's a soft tissue mobilization technique. And you're going to breathe out to pull the rib cage down, and then rotate the shoulder back, pulling its attachment point, the coracoid, or the little bony outcropping of the scapula, back. Again, that's where it attaches and how we can pull it forward if it's over facilitated. Okay, so Hunter's gonna do that. He's gonna get on the wall. He's gonna put his weight into the ball. And he's gonna bear down on that ball. Now, the main consideration here is that we don't use so much pressure that it distorts the shoulder joint. So if I push too hard, it's gonna roll the shoulder inward, and that's actually gonna dissociate the joint center. So we don't wanna do that. We just wanna hold it under pressure. Now again, we don't wanna flex it or extend it. We don't wanna do anything with the muscle out of the gates. We just want it to be soft, passive, and then push into it. We would hold that pressure point, and it should be maybe a 6 out of a 10 on a pressure scale. And then we're gonna start after about 30 seconds to breathe out. That's gonna pull the rib cage down that it attaches to, and then we're gonna rotate the shoulder posteriorly, meaning it's gonna glide backwards. So you're gonna breathe and roll together, and as you do that, you'll feel it as, again, a shearing force or pressure on that muscle. So do you feel that, Hunter?
Mm-hmm.
Yeah. So we would go through these breathing mechanics about 6 to 10 times, breathing out deeply for a count of 4. Relax it, let it go back to soft, and then push in a little bit deeper with each subsequent application. Once you're done with that, you would go to the opposite side of the body. All said and done, it should take about 1.5 to 2 minutes on both sides. And then we're going to tackle the next muscle that elevates the shoulders and pulls it upright or upwardly. It's called the levator scapula, another big issue with that upper cross dominance. Let's get right to it. The levator scapula is a muscle that attaches the superior ridge of the shoulder blade up to the cervical spine, and it attaches at your C1 through 4, so the first 4 vertebrae of the cervical spine. Now, its primary action is to lift and shrug the shoulders up. That's why they call it the stress muscle, because when we're cold or anxious, we have a tendency to guard and pull our shoulders up into our ears. So the muscle is an overused muscle. We see this a lot because we're in a desk or we're behind a desk, we're looking at a screen. Lots of reasons why posturally we overuse the muscle. And again, what it's doing is it's distorting the way the shoulder rides or lays on the rib cage. So if this is a taut muscle, we would normally see it as a forward head carriage, and your head would tip back, or you would see more extension than it should. That puts a lot of extra pressure on the vertebrae, and it means that you're going to start to lose the natural curvature of your neck. Now again, that's something that we're going to want to protect. The spine needs to be healthy and in a neutral position. So what we're going to do is use this ball once again and isolate the levator. Now the levator attaches to the superior ridge, so if you trace your scapula, you'll find that it has a little corner here, and that's the superior internal ridge of the scap. And then the muscle is going to come up diagonally and feed into the transverse processes over here of the cervical spine. So what we're going to do is just go a little bit superior to that ridge and then palpate again from medial to lateral, and you'll feel a little line. You can feel straight away on Hunter where that guy is. Now remember, the muscle lays underneath the bigger trap muscle. So we're not attacking the trap, we're attacking the levator. So once you find that little bulge, he's going to apply the ball underneath of it, distal or inferior underneath, and then work up. So he's just gonna put pressure underneath the bulge or the adhesion, push upward, shear it, but not really move it, just underneath the ridge of that little apex. You feel that?
Yep.
Okay. Now we're gonna hold the ball there, keep it there for about 30 to 60 seconds, and then he's gonna start to stretch the muscle from where it anchors at the cervical spine by flexing his head down, tilting it to the opposite side, and rotating it gently. So this is called a pocket stretch because he's looking downward at his opposite pocket on the opposite hemisphere of the muscle that we're targeting. With that in traction, or, and again, an isometric position, not moving, he's gonna hold it there and then begin to breathe in and protract the scapula, pulling it away, letting it roll around the rib cage into the chest wall while the ball's under pressure. The act of rolling the scapula forward will stretch that muscle under the pressure of the ball and begin to break it down to help to elongate that tissue so that we take the pressure off the elevation of the shoulder blade. Does that make sense? Got it? So Hunter's gonna do that. He's gonna place the ball back there. For some of you who have, again, true labral issues where there might be some breakdown, you're gonna wanna be careful, especially if it's bilateral on both sides. You may wanna get a sock to put the ball in so you don't have to reach back so hard. That might actually aggravate the opposite shoulder, especially if you're dealing with issues again on both sides. So he's not doing that today, but that is a tip to take home with. You're gonna put that ball on that little spot. You'll notice that he's also squatting down a bit. He's doing that so he can leverage his body weight and push deeper into that muscle. Right, so he's not upright, he's squatted down and then leans back into it. Okay, you feel that?
Mm-hmm.
Okay, so he's holding it again for about 30 to 60 seconds. He's gonna let the muscle relax and then he's gonna start to tuck his chin down, bring his chin into his sternum. He's going to laterally tilt to the opposite direction and then he's gonna rotate to the opposite direction looking down at the pocket. After he's reached that position, he's gonna begin to breathe in and protract the arm forward. That's the scapular motion. Protract the scapula and then internally rotate and draw the arm across the body. Breathe out and relax. As you relax, you'll sink into the belly of the muscle one more time, and you should notice that the muscle starts to soften and you can actually get in deeper each time. You're gonna wanna go again through about 6 to 10 breathing cycles. You're gonna wanna do each side about 1.5 minutes, and then we're gonna meet or get into our activation. And that's gonna start targeting the obliques that hold the rib cage down. Okay, feel good?
Yeah, feels really good.
Yeah, this is kind of a scratch that feels good to itch, right? It's a muscle that we all overuse for the most part. So by attacking this guy, you're really gonna see a noticeable improvement in the mobility of the shoulder, and that's gonna feed into the next exercise that we're about to do, so let's get started. The next segment has to do with the activation of your external obliques and your rectus abdominis and transverse abdominis. These are your abdominals, and they're technically considered spinal flexors. Spinal flexors mean that they pull your body weight forward and create a rounding or C-curve of the spine, and that allows you to pull the rib cage downward or internally. It's important to note that in order for our primary respiratory muscle, our diaphragm, to work efficiently, we need to be able to keep our rib cage down or internally rotated, which would be considered a protraction of the ribs, so that we can breathe in and elongate and open our rib cage up. So it basically means we have to cinch the ribs down with our abs and then breathe in and feel the expansion around the back. That's very important as it provides the right mechanics for the ribs to create a nice convex curve for the scapula to roll around. If that's not going on, the placement of our shoulder blade is going to be offset and it will naturally lead to an inferior or internal inferior rotation and protraction. Now that's a hard concept to keep in mind, but what it really means is we want to make sure that our abdominals are strong enough to hold the rib cage where it belongs. Oftentimes with people with labral tears or distortion in the shoulder, we'll see that the ribs are hyperextended, lifted up, and they don't have enough intra-abdominal pressure to keep it in a natural neutral position. So today I'm going to show you how to keep those rib cages down and then show you how to activate the muscles that stabilize the shoulder with the centered rib cage position so we can upregulate the central nervous system and make this stick for the long haul and hopefully reduce some of the pressure that you may be feeling on the shoulder because of which. Okay, so you'll notice Hunter's on his back. If he arches his back out, you can see, I'll pull his shirt up, you can see that there's a big rounding or an arching of the spine. When he does that, his ribs lift up. Now if he breathes all the air out of his lungs, his lower back will imprint down into the mat and his ribs will depress and again protract. That's gonna hold his abdominal pressure and his ribs down. What we want to do is begin the position by getting into that area first, by getting all the air out. And then, while the abdominals are engaged, he's gonna breathe in, lift up, and rotate from one side to the next. This is not a tilt, so he's not tilting side to side, it's a rotation. He's putting his arms behind his head and supporting his head. So he's not gonna arch through the neck. Remember, we wanna reduce that movement. His chin's gonna be tucked. He's gonna support just at the ridges or the mastoid process of his skull. He's gonna breathe in and lift, and then rotate about 15 degrees from side to side. Now bear in mind, if there is a labral tear and there is pain because you're lifting your shoulder up, you can contraindicate this by bringing the arms down closer towards the chest, but just be aware that you're gonna need to tuck your chin and keep your head centered over your spine as you lift up. Try not to let the head extend. Okay, so Hunter's gonna give you a couple examples. He's breathing out, getting the lower back to stay in a neutral position. He's gonna hold that rib cage position, breathe in against it, rotate, and then breathe out to a count of 4 till it gets to the bottom. The goal would be to try to get all the air out of your lungs by the time you get to the bottom of this position. Let's do a couple more just to show him what it looks like. Also notice he's not bringing his arm in. So he's not cranking that arm in, drop it in like this. He's not arching his neck out. That's the customary compensation pattern. He's also not shifting his weight side to side through his hips as he comes up. He's maintaining a nice neutral pelvic position. His knees are bent at 90, his heels are planted. He's pulling back slightly through his heel to engage his hamstring, and that's gonna help to maintain a neutral pelvic alignment so he doesn't twist through his lumbar spine. By doing this position and isometrically stabilizing the lumbopelvic, he's gonna be able to fully engage the external obliques that are gonna help to hold those rib cages down. Okay. Now keep in mind, if your pectoral girdle, like your pec minor and your pec, your levators, these accessory respiratory muscles are tight, notice that when you pull your rib cage down, your arms want to roll forward. Because now we're actually centering the rib where it belongs, and the true length relationship of that pectoral girdle is going to start to surface, and then you're really going to start seeing it as your true posture through your shoulders. And this again is what we're trying to remediate or to correct for. So if you notice that your shoulders are rotating forward, try not to fight it too far back because you'll put your shoulders into a compressed position, and that might aggravate the issue that we're trying to reduce in the first place. So again, what we would want to do is a set of 20 repetitions, 2 count up while you're breathing in, a 4 count out as you're coming back. You would alternate left to right, and you would give yourself a minute between your sets to recover before we move into our next exercise, which is now going to coordinate the respiratory pattern, the depression of the ribs with the scapular alignment so we can put all these pieces together, coordinate our body, and get stronger. Let's get to it. The next integrated movement is going to be what we call a shoulder W. Hunter is laying in a supine position or facing up, and now we're going to coordinate the same breathing mechanics that we just worked on with our oblique crunches and then factor in the movement of the scapula or the shoulder position. So what we want to first again engage is our abdominal pressure by breathing all the air out of our lungs. By doing that, it'll pull our ribs into a depressed position or protract them. Now by doing that, you might notice that the pressure on your pecs or your neck starts to rotate the palm upward. So that's okay. If you see that, if you're unable to keep the arm rotated down to 90, well then you're not gonna move the arm and we're gonna work on isometric pressure. That means as you breathe out, you're gonna rotate your palm externally into the ground below you. So Hunter's on the table, so he wouldn't have the ground to push into, but he would if he was laying down on the floor, and he would be pushing down externally, so he's gonna rotate down. That's gonna glide the shoulder and the arm back into a neutral position. So again, if you see that, an elevation after you get all the air out of your lungs, do not move the arms. Once he's at 90, he's going to breathe out, keep the ribs, and then he's gonna breathe out further as he lifts the arms overhead until he starts to feel his shoulders start to wanna rotate internally. As he gets to the apex of that press, he's gonna breathe in, keep the ribs engaged, or again, pulled down. Even though he's breathing in, remember the abdominal pressure has to remain there, and then breathe out, lift overhead, and push down externally. These movements are gonna help to teach the body how to maintain the positioning of the rib cage while keeping the scapula back in a retracted and depressed position. If we have a propensity towards elevating and internally rotating, this is gonna surface as we draw the arms up. So we're gonna work within the range of motion that allows us the ability to keep our shoulders in contact with the rib to work the deficient range of motion that is unavailable to us because of our postural distortions. So he's gonna stay in this motion, breathe out to a count of 4, and then as he glides his scapula back, he's gonna breathe in, but he's not gonna let go of his abdominal pressure, so he won't let his ribs flare open. Very good. So a couple key points, make sure your lower back basically stays in contact with the mat the entire time. That's how you know your abdominals are engaged, you're not hyperextending. Make sure that as you lift the arm up, they don't shrug or rotate internally, and make sure that there's no pain through the entire process. Once again, if you breathe out and the shoulder rotates anteriorly or forward, then you're not gonna move at all. You're just gonna breathe out and pull back and teach those systems how to stabilize themselves until we're able to isometrically maintain the posture, and then you would add the motion over time once you're able to get that arm to a 90. We would do 2 sets of 20 repetitions. Once again, the time under tension would be 2 seconds to 4 seconds. Slow up. 2 down, 4 up, 2 down. It would take about 2 minutes. If you fatigue, you start to compensate or the lower back comes off, go ahead and stop. Work within the time that you're able to maintain the precision, and then again, take up the battle. Make sure you try to get through 2 sets of 20 repetitions, or however many segments of that it takes to get to, again, roughly 4 minutes of time under tension. So with that, that's going to bring us to the end of our activation. And now we're going to go into a final strength position to hold the rib cage down and really work on getting the scapula back and depressed. We're going to target the rhomboids and lower mid trapezius. And for that, we're going to need to stand up, get ourselves an exercise band, and let's get to it. The final exercise we're going to do today is a strength exercise targeting the retractors and depressors of the scapula. Recall that the destabilization of the shoulder joint because of the overused pec and levator can lead to a shortening or a narrowing of the gap between the humeral head and the actual shoulder joint itself. So what we want to do now that we've positioned the rib cage down to a neutral position from targeting it with those first 2 exercises is teach the shoulder blade to glide around the rib cage. And that's called thoracic scapular rhythm or scapular thoracic rhythm. So what we want to do is show you how to pull the rib down into a depressed position by breathing out, and then retract, depress, and rotate the arm around it without elevating or internally rotating. To do that, you're gonna need a small exercise band. We have it anchored here to one of our brackets. It's just about the height of his knee, and he's gonna stand away from the wall about 2 to 3 feet. Now he's pulling the band across the body, so there's internal horizontal adduction of the arm. The pressure is pulling him across. So now he has to pull it into horizontal abduction and adduct the scapula. So what we want to do is make sure of a couple things before we get started. We're going to keep the arms down and depressed, so he's going to depress the shoulders down out of the joint. He's going to keep his head over his rib cage, his shoulders are drawn back, and the moving working arm is not going to bend the elbow. If you're fatiguing in these muscle groups, or if you're going to compensate, the tendency is to shrug the shoulder and pull open like we're trying to do a deltoid raise. That's not the motion. The motion is to keep the shoulder depressed the elbow extended, and we're going to glide from the shoulder blade around the rib cage. So it's a rotational movement of the shoulder around the rib. If you go too far and the muscles are too taut, you'll start to notice that the humerus rotates internally and lifts. So that would be your functional range of motion to the point of seeing that compensation. So if that means that you start here and bring your arm here before it starts to internally rotate, that would be the range of motion that you would want to work in. So again, start by breathing all the air out of the lungs. Retract the arm back behind the shoulder. Pack the scapula back towards the spine. And then breathe in, expanding through the rib as you let the arm come forward. As soon as you feel that first momentary release of the scapula, breathe out, lock the rib cage down, and pull the arm around. So we're going to want to complete 2 sets of 20 repetitions on each side of the body. Make sure that as you roll your arm around, that the arm stays as an extension of the scapula and the whole shelf rolls around the platform. Your ribs are the stationary element and the scapula is gliding around it. You'll see that as an internal rotation and then an external rotation of the scapula as it glides back towards the spine. Good job, Hunter. Again, if you start to fatigue, you're going to notice that as you pull your arm around, your rib will rotate with it. So you'll start to shimmy through your hips. You can stop that by planting your heels down, engaging your glutes, and keeping your pelvis stable. And remember, we're going to want to breathe out to depress the ribs as you glide the shoulder around, and then breathe in as the shoulder glides forward. Practicing that scapulothoracic mechanic is going to allow you to be able to stabilize that shoulder and learn how to keep it safe when we go through pushing and pulling movements. This is the beginning of learning the appropriate biomechanics of the shoulder joint before we go into bigger complex motions like a pull or a push. Remember, you're only as strong as you are stable, and the ability to isolate that scapula back into its retracted position will provide an environment for safety and protection for that shoulder joint. Remember, this was a topic on labral tear. If it's a true deep labral tear, you're going to want to see a physician. There's no way to remediate that or protect that. If you're starting to feel clicking, grinding, or a frozen shoulder, go out and visit a physician, have it assessed, maybe get it imaged. If there's a partial tear or maybe a slap tear, it's a version of the types of tears, that is something that you can restore. And again, if you just have altered postural positions in that shoulder joint, this is something that you're going to want to defer to, and you can help to restore the natural mechanics of the shoulder joint, and again, coordinate that with respiration. If you have specific questions on any of this stuff, make sure to reach out to us again at admin@fluidhealthandfitness.com. We want to hear from you. Also, if you like what you're hearing, make sure to subscribe to our channel. And on that note, our message is always, your body is designed to move, so stay in motion. Thank you for joining us, and we'll see you next week for another topic.
you.